to flu pandemics is a personal passion of his. So he's certainly someone worth listening to, and I'm delighted to say he joins me now. Doctor, and the point is here, you as someone who has tackled flu pandemics your entire career, so you're not trying to downplay the seriousness of the flu, you're simply trying to say we don't need all of these draconian restrictions, right?
Well, I think, flu is also quite serious. And in fact, when you compare flu to COVID, you actually get a false picture. And flu is probably worse than it appears because we don't test for it. So we we aren't really aware. So when people go to hospital and die of pneumonia and they have also had flu, it probably isn't picked up. So it is a serious thing, and it is a thing that can cause a pandemic, and we have to be aware that that's a possibility. So I think, we need to start to treat COVID like flu, and I think what we need to do is look back and say, look back at how we've handled the pandemic and say, did we overreact with social distancing and with all the self-isolation?
And do you think we did?
Well, I think with hindsight is a great thing, but I think I absolutely think we did, and in fact, I think I was saying throughout that I felt we did, and what we need to do is look back, not to criticise, because it is. I mean, who would want to be a politician? You have people breathing down your neck. It's very difficult to make decisions, but the reality is that we've had a huge number of excess deaths in the home, non-COVID excess deaths over the pandemic. Macmillan tell us that there are 50,000 cases of cancer that have not been picked up, that would have been picked up in normal times. So people walking around with a cancer which will come to light eventually, and there are all sorts of other things that need to be picked up either through health screening or through people going to the doctor if they have mild symptoms which might be caused by something serious, and so we have a time bomb of problems here of coming after us, and what we need to do is look back, not to criticize, but to say, how can we make sure that if and when there's another pandemic, that we don't launch straight into lockdown. It's terrible. Once you do get into lockdown, it's terribly difficult to get out of it.
Absolutely it is.